Greetings, esteemed colleagues and healthcare professionals. I'm Dr. Ashutosh Mishra from CardiopCon, a society dedicated to cardiovascular, diabetes, and renal diseases. Today, we'll explore the top 10 highlights of the groundbreaking Cardiovascular Kidney Metabolic Health Presidential Advisory. 1. CKM Syndrome Definition. Cardiovascular Kidney Metabolic CKM syndrome is a complex health disorder encompassing the interconnections between obesity, diabetes, chronic kidney disease, and cardiovascular diseases. This includes conditions like heart failure, atrial fibrillation, coronary heart disease, stroke, and peripheral artery disease. 2. CKM staging construct. The advisory introduces a novel CKM staging construct reflecting the syndrome's pathophysiology, risk spectrum, and opportunities for prevention and care optimization. The stages range from 0, no CKM risk factors, to 4, clinical CVD in CKM syndrome. 3. Lifelong screening approach. We now recommend screening for CKM risk factors across the entire life course. This approach aims to enhance prevention and management strategies in both youth and adults, with screening frequency and intensity linked to the CKM stage. 4. New risk prediction methods. The advisory describes innovative approaches for predicting CKM syndrome-related outcomes. This includes assessing risks for both atherosclerotic CVD and heart failure, starting from age 30, reflected in a new CKM risk calculator. 5. Interdisciplinary care strategies to reduce care fragmentation and improve outcomes. The advisory outlines value and volume-based strategies. These aim to enhance interdisciplinary care for patients with multiple comorbid conditions within CKM syndrome. 6. Addressing social determinants of health. Given the significant impact of social determinants of health (SDOH) on CKM syndrome, the advisory emphasizes systematic SDOH screening. It recommends incorporating SDOH into risk prediction and addressing these factors as part of clinical care for CKM syndrome patients. 7. Tackling adiposity. The advisory stresses the importance of addressing excess or dysfunctional adiposity through lifestyle modification and weight loss. This approach aims to prevent progression and facilitate regression along CKM stages. 8. Optimizing CVD risk reduction. A framework for optimizing CVD risk reduction in diabetes patients is provided, including guidance on selecting cardioprotective anti-hyperglycemic agents. The advisory prioritizes SGLT2 inhibitors for those with CKD, existing heart failure, or high heart failure risk, and GLP-1 receptor agonists for those with uncontrolled hyperglycemia, high insulin doses, or severe obesity. 9. Comprehensive kidney health assessment. Clinicians are encouraged to measure urine albumin-creatinine ratio alongside estimated glomerular filtration rate in patients with CKD, diabetes, hypertension, and metabolic syndrome. This comprehensive approach allows for better characterization of CKD and CVD risk, particularly heart failure. 10. Population-level CKM health optimization. Finally, the advisory provides a framework for optimizing CKM health at the population level. This includes enhancing education, investing in research, addressing SDOH, improving obesity care, increasing access to pharmacotherapies, supporting interdisciplinary care models, applying proven implementation strategies, and developing partnerships to support ideal cardiovascular health across diverse communities. In conclusion, this advisory represents a significant step forward in our understanding and management of CKM syndrome. By implementing these recommendations, we can work towards better prevention, earlier intervention, and improved outcomes for our patients. Thank you for your attention, and let's continue our efforts to combat CKM syndrome together.